Alright, welcome back everybody. I do believe this is going to be the final video for the series that I've been doing on high blood pressure, and I thought we figured off with actually the opposite of high blood pressure, hypotension. So I'd like to entitle this video for bread and butter primary care, hypotension and orthostasis when blood pressure is actually too low. Sometimes you get people who will ask this question. Oftentimes it's very healthy people, young, athletic people. They come in and they say, I'm concerned maybe my blood pressure is too low. I'm checking it all the time and it's 90/70. Isn't that too low? And usually my answer to that question is, well, how do you feel? Similar to hypertensive emergencies, the way you know blood pressure is too low is if there's end organ problems. So why do we even need blood pressure? We need blood pressure because we need enough pressure in the system to get blood from the heart all the way to the ends of our extremities and to all the organs. And so there has to be enough pressure to keep that flow going so that the blood gets where it needs to go. So too low blood pressure would be any situation in which the tissues that are needing blood aren't able to get it because there's not enough pressure. So generally, if you're a young, healthy person and you are not having any symptoms, you're not dizzy, you're not faint, you're not tired, you feel great, you're able to exercise, then your blood pressure is not too low. You just have an efficient system, and so you're able to operate with less pressure, which is very, very good because it's less wear on the arteries, it's less wear on your body. That's actually kind of what we're shooting for. Now, blood pressure gets too low when you stop getting the blood everywhere it needs to go. One of the most common things you'll see in primary care with low blood pressure is orthostatic hypotension. That is a drop in blood pressure upon a change in position, usually from either laying down into sitting or from sitting to standing. So oftentimes these people will come in and they say that they're getting faint and dizzy. You get a little more history and you find out that I stand up after I've been laying down, or if I'm sitting for a while and I stand up, I feel lightheaded, I feel like I might pass out, I get a bad headache, and those types of things. And so those are symptoms of orthostatic hypotension. Now, it may be the case that those people just have a low blood pressure generally speaking, and so when they stand up it gets worse. Sometimes it's a slowness in their reflex on standing, and so our arteries are reflexively programmed to tighten when we change positions. And so you stand up, gravity's going to pull the blood down towards the feet, our arteries tighten up to keep the pressure even when we change positions. Some people don't do that as quickly as others, and they may have orthostatic hypotension, or if they have low blood pressure for other reasons. If they're anemic, they have low iron, there's not actually all that much blood in the pipes, you could say, then that can also cause the blood pressure to drop more than you'd expect upon standing. And so that's one really common reason for low blood pressure. Other than orthostatic hypotension, for the most part, low blood pressure is a secondary problem. So it's not that common for people to have too low blood pressure, just like there's essential hypertension where it's just high and there's not really a particular reason. There's not all that many situations where you have that same thing with low blood pressure. Usually, low blood pressure is because there's some other problem. There's sepsis. There's blood loss because of bleeding, GI bleeding or menstrual bleeding or whatever the case may be. And so whenever someone's dealing with low blood pressure, that's oftentimes an emergency, and it's an urgent search to say what's happening, why is the blood pressure low, and then dealing with it. And so we'll deal with those situations in future videos as far as sepsis, hypotension, and those types of things. But it's just something to think about. It's a little different than hypertension in that it usually only happens if something's wrong. Orthostatic hypotension is one of those different things where you can have a generally healthy person who's having that problem with that. And so that's just a little bit on low blood pressure. So mainly remember orthostasis, that can be an issue, and that usually if blood pressure is too low, it's because there's something else going on. And so you need to find out if there's blood loss somewhere, if there's a low iron, if there's a thyroid problem, those types of things that might be going on. Otherwise, blood pressure is usually not too low unless you're having symptoms that are bothering you. So I hope that's helpful, and looking forward to doing some more videos on some different subjects and different things. And if something else dealing with blood pressure comes up, I'll add another video in. And for now, this is Dr. Stokes with Bread and Butter Primary Care. Hoping you have a great day, and we'll see you later.